So we're now recording, and I'd like to welcome Chris Kingsbury from Remploy. For those of you that don't know Chris, Chris has worked in the welfare to work sector for about 13 years, and he specialises in supporting those with health conditions, disabilities and barriers to employment. Chris is the National Partnerships Manager for Access to Work Mental Health Support Service, and he works alongside organisations from a variety of sectors across the UK to promote a healthy and productive workforce. So I'm going to hand over to you, Chris. Thank you very much for joining us.
Thank you, Neil, and thanks for the warm introduction, and thank you very much for inviting me this evening. Just before I start, I do have a presentation slide deck, Neil, but I don't seem to have the permissions to be able to share my screen. I'm just wondering if, whilst I'm doing the introduction, you could just check that for me, please.
Yep, bear with me 1 second. I will get that done for you straight away.
Oh, thank you. So my name's Chris. I'm the National Partnerships Manager for an organisation called Remploy. Thanks, Neil. And some of you may have already heard of Remploy before. Now, Remploy are an organisation that has been around since 1945. So very, very long time. And we were set up straight at the end of the Second World War to provide employment opportunities for disabled veterans. So you can imagine these gentlemen were returning home from conflict. The previous jobs that they had, they may not have been able to go into because they were maimed, injured, or found themselves having a disability. And so in 1945, the network of factories across England, Scotland and Wales was created to provide them employment opportunities for those disabled veterans. So that's where you get the term Remploy from. It comes from the term re-employ. Now, over the years, the organisation has evolved somewhat. So we're not technically having factories anymore. In fact, none of our factories across England, Scotland and Wales are now running. However, the separate entity of our business called Remploy Employment Services, that still exists today and provides a wide variety of local, regional and national contracts to both help disabled people into employment, but also to support those people that are already struggling within their job role in the workplace, but just require a helping hand to ensure they're productive in their job role, that sickness absence is reduced, and also they're preventing and managing the symptoms of their condition. And one of these such contracts that we deliver here at Remploy is called the Access to Work Mental Health Support Service. And it's what I'm going to take you all on a tour of this evening. So what am I going to cover? So I'm going to give you a bit of background as to what the Access to Work Mental Health Support Service is. I'm also going to give you a description of the eligibility criteria and the referral process, and also to give you some common examples of the types of support and interventions that we provide to individuals when they're being supported by us. In addition to that, you'll have the opportunity at the very end, that's if you're viewing today's session live, to view this session, to ask questions, should I say, live. If you are viewing this the session as a pre-recorded on-demand session, then you will get my details at the very last slide of today's webinar. So you do have the option there of asking me some questions after you've seen the session on demand. You can email me, or alternatively give me a telephone call. So one of the final things just before I begin, move on to our first slide, is essentially this is there to complement you within your job roles within occupational health. So use this as an additional resource within your toolkit. If you think you would like to have much more of a joined up approach in terms of working together with the organisations that you represent, you do please reach out to me on the details that I provide on the final slide, because we can sort out much more of a robust referral process, or even a better reporting mechanism in terms of the top level data, and also the awareness raising activities that we could provide to, such as a webinar like this. Anyway, I think I've introduced the session for long enough now, so let's get into the good stuff, which is telling you what we're here about today is to tell you about the Access to Work mental health support service. Okay, so what actually is the Access to Work mental health support service? It's the scheme basically that we've delivered on behalf of the Department for Work and Pensions here at Remploy since December 2011. So many of you will be familiar with Access to Work, a Department for Work and Pensions scheme, and it's a scheme that's been available since 1994 to basically help people with a health condition or disability to have them retain employment. And if I think back over the years that I've worked within Welfare to Work, many people with a health condition or disability may require funding via Access to Work that would help them with things such as adaptive technology or equipment, software for the computer, travel supports to help them get to and from work each day, job coaches, support workers, neurodiverse support. However, whilst there's lots of different providers specialising on the different elements of Access to Work, there's a provider here that provides the mental health element of support, and that organisation is Remploy. When we go through today's session, you'll identify that there's certain things around the Access to Work mental health support service, which is quite different compared to the mainstream Access to Work provision. And what I'll do is I'll highlight those to you as we go along. So the Access to Work mental health support service is designed to be independent, confidential, and vocational support for employees with a mental health concern to help them retain or regain their ability to participate at work. So just spending a few minutes on that statement. Now, many of you will represent organisations who me and my team at Remploy were not working in partnership with. However, we will be supporting a multitude of their employees, whether it be at this present time or previously since we've delivered the service since 2011. The thing is, the support is independent and confidential, so individuals can essentially gain our details maybe on Facebook or other social media, or they might have seen it in magazines or journals, contacted us independently, and unless that individual gives us verbal consent to do so, the employer doesn't have to be involved. However, and we'll discuss this later on in today's session, the employer can be involved in terms of their support package. So you've got that confidentiality element. However, many organisations that me and my team work in partnership with, they will get top level data if they request it in terms of the referral rates and success rates and common themes or trends that we've noticed in terms of declared mental health conditions in their workplace. Now, the next thing that I've stated here is that the service is designed to be vocational. But what do I actually mean by vocational support? It's very straightforward, actually. It simply means work-focused support. It's essentially all about the job. It's not clinical. It's not there to treat injury or illness itself. It's not a counselling service. What it's there to do is to give an individual the strategies to better perform to the requirements of their job role, whether that be duties or responsibilities, situations or environments that they're finding themselves working within. Maybe they have an increased level of sickness absence as the result of a mental health concern, so it would all be about supporting them in the workplace to prevent them from going off sick. And also maybe for individuals that are off sick, and help them in their return to work strategy, but also those individuals that are about to start employment with an organisation, declared a history of a mental health condition, and this can be used to ensure that they don't experience any difficulties during that early period of employment. It's difficult in itself when you start a job. It can be a daunting experience for some, never mind when you have that added barrier of a health condition or disability. So you may think, well, why would we use the Access to Work mental health support service when an organisation like the organisation that I represent obviously has occupational health, but also has the likes of an employee assistance programme. Well, here's why. The thing is that just because somebody has a mental health condition, it doesn't mean that they're going to be off sick and therefore require the great support from an occupational health team. And it doesn't mean that just because somebody has a mental health condition, it doesn't mean that they're going to require support by a counselling, usually through an employee assistance programme. And I'm sure you'll appreciate that for an individual to receive counselling, it could actually make their condition deteriorate even further. So what about those individuals that just need that helping hand to get through each working day, ensuring that they're productive within their job role, ensuring that they're preventing and managing the symptoms of their condition? And this is exactly what this is designed to do. It's there to give light touch support, which is vocational, to ensure that we're getting that person through their bad days. However, it can be used in conjunction with the likes of occupational health and or an employee assistance programme, particularly for those much more complex circumstances that people may experience. And I'll explain more on that shortly. Okay, so moving on. What are the types of mental health conditions would this support with? The answer to that is all mental health conditions. In terms of your declared mental, or should I say, diagnosed mental health conditions, it can be the likes of depression, stress, anxiety. They're the more common ones. However, it can be any, it's the full range, so it can be the likes of PTSD, bipolar, schizophrenia, eating disorders, just to name a few. It covers the full range of mental health conditions and it has a 93% success or retention rate. And this is based upon individuals performing well within their job role and managing the symptoms of their condition within a 9-month support period. So we're supporting people there for quite a long period of time. Now, that 93% is measured upon people being in their job role, being productive, managing the symptoms of their condition within their 9-month support period, as I said there. But what does that 9-month support period actually look like? So when an individual has actually access to us or referred to us, they are allocated to a local, what you call a VRC. Now, a VRC stands for Vocational Rehabilitation Consultant, and they're the great members of my team that are based within all localities of England, Scotland and Wales, giving them the wealth of workplace and condition coping strategies to take away and apply within the workplace. Our VRCs all have a varied background in terms of expertise. So in my team, we've got the likes of counsellors, psychologists, occupational therapists, just to name a few. They have that knowledge, they have that expertise, they have to demonstrate that continuous professional development, but they're just applying it with much more of a they're applying their expertise with much more of a vocational work focused approach as opposed to a clinical approach. And what will happen is they will support that employee for that period of 9 months. The employee won't have like a mixed bag of VRC supporting them. It would just be that one VRC supporting them for that 9-month journey. Now, since the pandemic, we've moved from a face-to-face model to a remote model. So every appointment will take place every 2 weeks, and during which the VRC will give the employee a wealth of workplace and condition coping strategies, examples of which I'll provide to you all shortly. And those appointments would take place inside or outside of working hours. It could be the case that if an individual gives consent, then there can be additional meetings as well with the employer representatives so that we can start to give the employers some advice and guidance in terms of workplace adjustments and recommendations. Essentially what we're doing here is within those meetings with the employee, we're giving them those workplace and condition coping strategies. We're noting them within their action plan. They're going away and trying those strategies out in the workplace. They're coming back for their next meeting a couple of weeks later. If they're working, great, then we can sign off their action plan. But if not, we'll find some alternatives, and that's how it will proceed for that 9-month period. So the final thing that I want to say on this slide here is that no financial contribution is required from the employer or indeed the employee. Now, in terms of the mainstream access to work service, it isn't free to access, and in many cases, the employer may be asked to pay a contribution dependent on the size of the organisation. So say, for example, if somebody has a custom-built chair to support their posture, the employer will pay a bit and access to work will pay a bit too. Doesn't work like that in terms of the mental health element. This is 100% funded by the Department for Work and Pensions. So say, for example, if you referred a patient that you were supporting with their consent, their employer doesn't necessarily have to be involved in terms of like signing a formal partnership or anything. You could essentially start to use this straight away as part of your toolkit. So there's no invoices, no consent forms, no formal arrangements. It's there for you to use straight away without paying a penny. Okay, so what I'm going to do now is I'm just going to move on to the eligibility criteria and the referral process. And it's very, very straightforward, this. So the eligibility criteria, well, there's two. The first one is that the individual must be in paid employment. It doesn't matter how many hours the individual is working each week. So the person can be working permitted hours, less than 16 hours a week. They can be working permanent. They could be working temporary, full-time, part-time. They could be a self-employed contractor. They could be attending work at the present time, or they could be signed off sick. And they could also be on an apprenticeship as well. In terms of the second eligibility criteria, the individual must have a mental health concern, and this can be diagnosed or undiagnosed. So if you remember on the previous slide there, I gave examples of the more common diagnosed conditions that we would support with. But the thing is, you don't require a formal diagnosis to access our support. For example, people may come to us to ask for our assistance without actually having visited their GP to get a formal diagnosis. They may come to us, with the feelings of being overwhelmed in the workplace, excessive worrying, low mood, problems with sleeping or eating, things that could be associated with much more of a wider mental health concern without actually having that formal diagnosis. So it's worth bearing in mind that if an individual that you're supporting isn't in a good place at this very moment in time, and you're supporting them, and you feel that they could have a bit of extra support within the workplace, then it doesn't matter if they've had that diagnosis or not. It's also worth pointing out here that the mental health concern doesn't necessarily have to be the primary health condition. It can be secondary to something that's more prominent. It can be, for example, respiratory conditions, neurodiverse conditions, issues with mobility or dexterity. As long as somebody has a mental health concern, that they would still meet their eligibility. And finally here, triggers may not be linked to what's going on in the workplace. We recognise that there's things that affect people's mental well-being, and in turn, they're taking it into the workplace and it's affecting them at work. And if that is the case, then we will look at the whole lifestyle element, not just what's going on within the four walls of the workplace. However, here's what is important here, that the mental well-being is being impacted or is impacting on the individual's work. Because the support is designed to be work-focused support, that we need to ensure that the individual is having a challenging time within the workplace, either whether it be being able to carry out their duties or responsibilities, whether that be they're finding it difficult within certain situations or environments, maybe they're finding increased level of sickness absence, all the stuff that I mentioned at the start of today's session. And if the mental well-being is impacting on that person at work and they meet those two eligibility criteria at the top, then a referral to the service should be considered. So if we do establish there that an individual is in paid employment, they do have a mental health concern, and it is affecting their performance or attendance at work, then how would they access the support? Again, this is really, really straightforward. So here's another difference between the mainstream access to work service and the access to work mental health support service. When an individual is being referred, they can first of all refer themselves, or alternatively, a third party can make a referral on their behalf. Also, you would come through to Remploy directly. You wouldn't go through to Access to Work directly, because this just quickens the process in terms of recognising that the individual needs assistance to actually receiving our support. I'll give you a couple of scenarios. So if an individual was to call us themselves on 0300 456 8114, they would go through to our head office in Leicester. They'll speak with one of our friendly advisors, who will ask them some questions to check their eligibility. And what they will ask is, what's your job role? Can you give a basic description of the duties and responsibilities that you're doing each day? The nature of your mental health condition and how it's affecting you in the workplace. So what duties and responsibilities are you finding it difficult? Or is there any deadlines or tasks or goals that you're finding it difficult to meet? Is your employer aware of the difficulties that you're experiencing? Because then that highlights to us, if they say no, that it could be the case that we bring their employer on board. And finally, we would ask for their national insurance number, because that ensures the Departments for Work and Pensions can support the or fund, should I say, fund the support for the individual. If an individual isn't comfortable to call us themselves, then alternatively they can email us with their name, their email address and their contact telephone number, and then arrange a call back. So one of our friendly members of our team will give the individual a call back and then process the referral that way. Another option here is that when you're having those confidential conversations with a patient and they're expressing to you that they're having problems with their mental well-being, it's impacting on their performance or attendance or well-being in the workplace, then you can make a referral on behalf of that patient, as long as that patient gives you verbal consent. And I think that's a lot more effective than you giving them a poster or a leaflet, you know, because it's difficult in itself recognizing that you have a mental health condition, never mind taking that huge step to give us a call or dropping us an email. So if that individual does give you consent, you can email us as well and provide the individual's contact details, and we'll give them a call back. That person will call back directly and get the process going in terms of the referral that way. Now, there isn't a waiting time at all, so the individual is given their first appointment with their consultant, usually within 48 hours. So it's a very quick turnaround from actually recognising that the individual needs assistance to actually receiving support.
Can I ask that everybody mutes their microphones, please?
Okay, thanks, Neil. So on the final objective for today, we're just going to look at some of the support and interventions that one may receive throughout that 9 months. Now, what I'll say here is that I'm literally just scratching the surface in terms of what our support and interventions look like. This isn't the entire list. I want you to also have a think on this slide and the next one. Any of those individuals that you may be supporting at the present time, and would any of the interventions be beneficial to them? And if that's the case, then maybe a referral to the Access to Work mental health support service could be considered. So under interventions, we've got the likes of a wellness recovery action plan. Not everybody would receive one of these, however, whilst we do ask that everybody completes a psychological well-being or self-esteem assessment. Now, this is a way of us measuring distance travelled from where the individual was at the start of the support period, and where they were halfway through at month 6, and where they are at the very end when the 9-month support period finishes. Now, the vast majority of the support is provided by the vocational rehabilitation consultant themselves. So they're given their personal expertise and knowledge to ensure that the individual's back on track within the workplace. However, at their disposal, they've got lots of different resources available to them in the form of smartphone apps, health and wellbeing portals, online CBT, so digital interventions that an individual can access in between their 2-week appointment to get access to things such as mood and behaviour management, anxiety management, um, physical exercise trackers, healthy eating trackers, all those things that could not only support that individual's mental well-being, but their whole health and well-being in general. There is also self-help and resilience toolkits that the VRC is applying themselves, which I'm going to go into a bit more detail about on the next and final slide. And next up here, we've got employee guidance for reasonable adjustments. This is really useful. Now, if an employee gives us consent to do so, then we're able to work alongside the employer. And that's really useful because what it does is allow us to put that preventative measure in place with the employer, ready for when our 9-month support period ends. Now, there's some things that we would do, and there's some things that we wouldn't do when it comes to working alongside the employer. Things that we wouldn't do is attend things such as formal sickness absence review meetings or disciplinaries, give legal advice or guidance, health and safety advice, or replicate the role of trade union representation. Here's what we would do. We would better educate the employer about the individual's condition and its impact on them. And also on the days that the individual isn't having a good day, the telltale signs that the employer can apply to ensure that those adjustments are put in place, to ensure that, yeah, the individual is being productive within their job role, but also that the mental well-being is maintained, and finally that the employer is still having a productive workforce. So you've got that employer guidance element, and the employer can come on board at any stage of the 9-month journey. So it could be the very beginning, it could be halfway through, or near the end. It's totally up to the individual, because we'll always ask within that fortnightly appointment, would you like your employer to be on board? Now, the next bit, this will be really useful for you all. How does this work alongside occupational health? It works great alongside occupational health. And we have lots of different occupational health organisations and departments and professionals across England, Scotland and Wales that are referring to our service. Here's the best way I've seen it applied. If you can consider the individual's rehabilitation as 2 phases. So phase 1 being that clinical intervention that you're providing, and that clinical stuff to hopefully support the individual to the stage where they're able to go back into the workplace. But as the individual is on the cusp of returning to the workplace, then the occupational health practitioner then makes that referral through to Remploy for phase 2. And it's all then about the work-focused interventions. Yes, the individual will shortly be going back into the workplace, and eventually now they're back in work. We're all about giving those work-focused interventions so the individual doesn't feel like they're in a bad place again, that the individual doesn't go off sick, and above all, that they're retaining employment. Moving on to the right-hand side, some individuals, and if you recall, I mentioned this at the start of today's session in terms of the eligibility. Some individuals may have a much more of a prominent or a primary health condition or disability, and in some cases, not all. That might be the trigger around the individual's mental health condition. So, for example, a neurodiverse condition or issues with mobility, dexterity, or pain management. If it's deemed by a VRC that the core trigger to the individual's mental health symptoms is around much more of a prominent or primary health condition or disability, then we can make recommendations for the individual to gain additional support through the mainstream access to work service, for the examples that you can see on the top right-hand side of your screen: workplace assessments, holistic assessments, adaptive technology or equipment, job coaches, support workers, travel support, or even training courses related to that individual's particular condition to help them better understand it more. These aren't the things that are provided by us here at Remploy, but indeed another access to work supplier, depending on the nature of the individual's condition. Whilst signposting is a very small element of the support, we can signpost. So it could be the case that we could cross-refer to an organisation's employee assistance programme if we deemed counselling to be beneficial, GP or clinical support if the individual hasn't had a formal diagnosis, and charitable organisations that can support with the things that are going on outside of the workplace. For example, managing debt and finances or bereavement, to name a couple there. But guess what? That is only a small fraction of what we do here. And to be honest with you, this is the main bulk of what we do. It's called Workplace and Condition Coping Strategies. And I'm going to finish off today by just explaining what they are. So when an individual first joins us and they're allocated to their local VRC, within the first appointment, what they'll do is they'll develop with their VRC what you call an individual support plan. Now, this document is basically stating the nature of the individual's job role, the nature of the individual's condition, and its impact on that person within the workplace. And then subsequently, it ends by the VRC listing what he or she wants to apply in terms of self-help toolkits, workplace and condition coping strategies that they are going to apply to get that individual back on track at work. And what they tend to do is they break down those strategies into workplace coping strategies, so examples that you can see on the left of my screen, and condition-based coping strategies, an example of which that you can see on the right-hand side of the screen. Now, I'm just scratching the surface in terms of the more common ones, but I want you to imagine that with every fortnightly appointment, the VRC is giving the employee lots of different workplace and condition coping strategies to take away and apply within the workplace. So say, for example, if I met with my VRC and he or she were giving me strategies to better organise, plan and prioritise my workload. They would also give me strategies around relaxation and fatigue management and anxiety management. It's all noted down on my action plan. And then what happens then is I go away, I give them a try, both in work and outside of the workplace. 2 weeks later, I meet with my VRC again, and my VRC asks me, how are those strategies working for you? Now, if I said, yeah, organisation, planning and prioritisation, it's working okay. Yeah, I feel like I'm getting by with those. It's a big improvement. Relaxation and fatigue management, yeah, that's fine. I'm getting well rested now. I'm not as tired when I'm in the workplace. However, anxiety and stress management, no, those strategies didn't work for me. And my VRC would then say, well, okay, it didn't work for you. Let's try something else. And they would give another approach to ensure, we're trying different strategies to better manage those anxiety levels through different approaches. So, okay, if one doesn't work, then we can try an alternative. You see, the way this works over that 9-month support period is every 2 weeks. And what you'll probably get an idea of now is we're applying those strategies, we're reviewing them. If they're working for that individual, we'll keep those strategies, but if they're not working, we'll try alternatives. You see, it's all about fine-tuning those workplace and condition coping strategies throughout that 9-month support period. Maybe complementing all that with those digital apps and exercises and activities in between those appointments, and maybe even bringing the employer on board. But essentially, it's all bringing this together to ensure that by the end of that 9 months, the individual's got a wellbeing plan that is specifically designed for them. Ensuring that the individual is present in the workplace, they're productive, and they're preventing and managing the symptoms of their mental health condition. And above all, retaining employment. So what I'm going to do next is I'm going to show you a short 2 or 3 minute video from a customer perspective of how they found the service, from start straight through to the end. And whilst you're viewing today's video, it might be worth you just considering if there's any questions that you would like to ask me. And feel free to ask those questions verbally by raising your hand, or alternatively, you can ask those questions by typing them within the chat box function. In the meantime, I'll show you this short video, which I hope you find useful.
It's just a normal day. All work and no play. All of a sudden, I feel numb. Recently, everything seems glum. It's 10 a.m. My next meeting is due. Put my camera on, muddle on through. Each time I speak, my throat feels dry. I just feel like I'm living a lie. My manager notices, bags under my eyes. She questions me, and I start to cry. I admit to her, I have not slept, and confess how my anxiety has crept. I can feel the shaking in my hands. My chest feels heavy as we make plans. My manager makes a referral to the Access to Work mental health support service. I feel nervous. I get a telephone appointment. They tell me they support mental health in employment. I'm introduced to their consultant, who makes me feel I am important. As I start to explain what I'd most like to gain, she completes a support plan for me, which is as personalised as can be. For 6 months, I can see I get contacted bi-weekly with different resources and advice. I slowly start to regain my life. As my mental health improves, my anxiety, it starts to lose. I move on to the light touch team, and once a month they contact me. Through their continued support, I can battle any negative thought. When my 9 months comes to an end, my mental health becomes my friend. Contact our Access to Work mental health support service team today.
Hopefully you found that video useful, really, to give a good snapshot of what the service looks like from start to finish. I personally think it's great. I think it's really powerful and really hits home that message about supporting individuals' mental well-being in the workplace. Before I hand over to some live questions, if there is any, here's my contact details. So my personal telephone number that you can reach out to me on to ask any questions about the service itself is 0776 636 4155, or you may email me at chris.kingsbury@remploy.co.uk. And if you did want to have much more of a joined up approach in terms of collaborative working or a partnership, then again, please feel free to reach out to me on those details. So I'm going to stop sharing my screen now, and I'm going to hand over to yourselves for some questions.
Right, okay, let's go to Linda first. Linda, you've got your hand up.
Hiya, Linda. You're on mute there, Linda.
Silly. Right. So, hi, Chris. Thank you very much. That was really interesting. I really enjoyed it.
Oh,
I've got three things I'd like to ask you. It's more for clarification than questions, because what you're describing is quite different to what I sometimes see, and I suppose that's because I usually see access to work on the whole. So what I would like to know is, first of all, is the service the same in all 4 UK countries? Is it the same in Ireland, Wales, Scotland and England?
So the Department for Work and Pensions Access to Work service is available in England, Scotland and Wales, and we're no different on the Access to Work mental health support service. We operate in all localities of England, Scotland and Wales. In Northern Ireland, it's a completely different service. It's operated differently. So we don't have any coverage in Northern Ireland, just within Great Britain.
Okay, that's really interesting, and I'm really impressed at what you're telling us as the gap between the referral or the self-referral and action. That's really impressive. And you do that over 9 months. How big's your workforce? And if potentially if we all went off and referred somebody to you tomorrow, would that start to go wrong?
So at the moment, we've got anything around 40 to 50 VRCs, but it's an ever-growing figure. But in terms of like being operationally able to facilitate all those meetings, we're way within our service level criteria set by the Department for Work and Pensions. Like there isn't a cap on referrals or like a pot of money that's going to run out. And to be honest with you, from our perspective and the DWP's perspective, the more people refer to this service and utilise it, the longer it's going to exist. So don't ever be concerned about us not being able to support, because we are way within capacity of being able to do that.
Okay, well, thank you. That was really interesting. And I'll maybe give you a ring.
Hey, yeah, no worries. Nice to hear from you, Linda.
One quick one from me, Chris. Have you seen the number of referrals go up since the pandemic?
Yeah, not only go up, Neil, but the circumstances or the nature of people's mental health conditions is a lot more complex compared to what it was before the pandemic. And I don't know if you yourselves have experienced that too. I'll give you an example. Like some people have struggled with the social isolation element. So where prior to the pandemic, they were working in large open plan offices, and then they've gone to work from home since that time, but they're not seeing people, and they're missing out on that social interaction. So they could be struggling with that side of things. But then alternatively, on the flip side, you've got individuals that are really anxious about returning to the workplace, because employees are saying, right, you know, it's time for us to go back to work, and they have real anxieties about that. Yeah. You might have individuals that are experiencing long COVID, or they may have really gone through like a really bad experience or sad time at the result of COVID, and they're finding it difficult to feel well as a result of that. So yeah, Neil, numbers have greatly increased, and equally the needs of the individuals in a lot of cases a lot more complex.
Yeah, I would imagine. I mean, I'm not in clinical practice anymore.
Yeah.
But you know, reports from students that I have interaction with was, you know, that there are a lot more complex cases that are coming through.
Yeah.
That have multiple variables in terms of cause and effect and what have you. So yeah, I suspected it might be, but just wanted clarification. Right, lovely. Libby, you've got your hand up.
Hi, Libby. Nice to see you again.
Yeah, I know. I'm a big fan of yours. And I think you presented absolutely fantastic. And I had some questions written down, but you answered them. So you've done a really complete presentation. So thank you for that. I think it's great that people don't need a formal diagnosis.
Yeah.
I mean, the whole service almost sounds too good to be true.
I hear that all the time.
That 48-hour turnaround is really hard to believe. And I have seen on social media, on our Facebook group, the Occy Health Facebook group, I don't know whether people have got that experience feet on the ground. So I'd be curious to know if anyone's listening in, if they wanted to add anything about that. But if it is 48 hours to speak with a consultant, that's brilliant. Is that video available on YouTube or somewhere, was my other question.
Yeah, it is also available on YouTube. So if, for example, you went onto YouTube and you type just in Remploy TV, you can see it there. It's probably our most viewed video.
Thank you. And last question, your slides say in partnership with Maximus. What's Maximus?
Maximus is our parent organisation. So Remploy used to be a government-owned organisation, but in the last 10 years, it's moved from a government-owned public organisation to a private organisation. So they're basically Maximus is our parent organisation.
But it's still funded through the DWP.
Yeah, that's right.
Complicated. Okay.
It is, yeah.
Chris.
Thanks, Libby. And just to say, when you mentioned there about the YouTube video, if you did ever want to get a link to that sent to you via email, then please just feel free to reach out to me. Also, I've got electronic copies of posters and leaflets, but also paper-based leaflets and posters as well that are professionally printed. We've got lots of stock available at our head office in Leicester. So if you did want to have some of those sent to you free of charge, just feel free to reach out to me via email, sorry, and I can send them out to you, no problem.
Okay, I think we've got time for one more. So we've got Janet.
Hiya, Janet.
Hello.
Hiya.
Thank you very much. My question is about your vocational rehabilitation consultants. So what sort of background do they mainly come from?
It's a varied background, to be honest, Janet. So in my team, we've got counsellors, occupational therapists, psychologists. So they do have that background and expertise. You have to all go that continuous professional development. It isn't a necessity, however, for
effectively with Grammarly.
it's the individuals that are working within our team. It isn't a necessity for them to be clinically trained, because the support itself is not designed to be clinical. However, as an organisation, we do feel that's a lot beneficial, and so that's why we have those with an expertise in that area.
And I've just got an anecdote. Thank you very much for that. So we had somebody with a personality disorder, quite a significant personality disorder, a couple of years back, and we brought in Remploy. And it was, as long as the individual agrees for management to be involved, it can be a phenomenally useful process. Where we found that it didn't always work so well is when the individual doesn't agree for management to get involved, and obviously they've got autonomy there. But that was just my feedback. So when the management is involved, the whole process worked incredibly well.
It does. It is a lot more effective when the organisation or the employer is on board, because, like I mentioned in the presentation, we're able to put that preventative measure in place with the employer ready for when our 9-month support period ends. So the support does work without the employer being on board, but it's a lot more effective when the employer is on board, which, to be honest with you, given the nature of all your job roles within the occupational health sector, I'm guessing that the majority of your patients, the employer would be on board. So I think that will work great for yourselves.
I think it's sometimes we've come in and Remploy's been involved, but the employer hasn't been involved. But sometimes we've got Remploy involved and actively brought the lot together, and that's been really helpful.
Oh, good. I'm glad. So please feel free to utilise the service now, everybody. You don't have to sign up any formal arrangements or anything like that. It's just an additional toolkit that you can all use now going forward when supporting your patients. I hand back to your good self, Neil.
Okay, that's wonderful. So on behalf of iOH, Chris, thank you very, very much for joining us this evening. As been highlighted by Libby, Janet and Linda, a really very comprehensive overview of the services that the mental health support service can offer from Remploy, and it hopefully will be published on our YouTube channel. I've actually put in the chat a link directly to the video as well. So I do apologise for that very brief interruption when my sound cut in. So that was just the YouTube ads. And yes, thank you very, very much for your input. I'm sure that we'll be getting you to write in OH Today at some point, either you know, an article that can go in, that would be really good to follow up this today. And
I think it's already in, Neil. I've just seen it. I've just seen the mock-up.
Oh, you have? Yes, of course you have.
Yeah.
Yes. So, yep, absolutely great. So watch out for that OH Today coming out. I'm sure we'll send you a copy, Chris. Obviously, you'll get the actual article sent directly to you as well. So obviously you can use it for your own CPD.
Thank you, Neil, and thank you everyone for inviting me in this evening. It was nice to meet you all.
Yes, and thank you, Libby, for your recommendation as our Director of Mental Health and Wellbeing. Libby always comes up with the goods, so that's brilliant. I think we've got a few more webinars planned for the rest of the year. Lynn, can you give us a quick overview? You're on mute.
We're having a little break over the summer, Neil.
Yeah.
We're going to start again in September, so there'll be more news coming out. So.
Okay, so from iOH and I'm sure from Remploy, we wish you all a great summer vacation. Hopefully you'll be able to get some downtime, and we'll see you again in September. Thank you very much indeed.
Thank you.
Bye.
Take care now.